Well, we now want to head into Parliament, where Acting Director General in the Ministry of Health, Dr. Patrick Amoth, is currently before the National Assembly Committee after he was nominated to the position of Director General Health. Let's cross over to Parliament and listen in.
Jaldesa and what the Senator Ledama said, the biggest structural change in the health system in this country has been devolution. And what provisions in the devolution is available to us, and how have we used it, and how would you use it even better to harmonize services between the Ministry of Health headquarters and the counties, and amongst the counties themselves, and relating this to human resource, supplies, referral services, primary healthcare network, and donor-funded programs like vaccines, malaria, TB, and HIV. Thank you.
Senator Amina.
Hamida Kibwan. Thank you, Chair. My question is, Daktari, health financing is a critical enabler for the attainment of UHC, the Social Insurance Fund. The current one, you call it SHIF, has replaced NHIF. As we speak, the initial implementation date has been extended to July, from July to October 2024. And on 12th July, the High Court of Kenya found specific clauses unconstitutional. Now, in your view, what are some of the gaps in the implementation of this shift in policy? And if you were to do it again, would you approach it in any differently, and how?
Thank you, Senator Amida. Ward Chief, then Oron.
Thank you, Chair. Some are overlapping, but DG, if appointed, and we wish you well, there are some concerns. Even if health is devolved, but you are going to be the Director General for the whole country. Number one, self-medication is on the rise because access to prescriptions is limited to many Kenyans. And if not abated, then we are going to have a lot of drug resistance. How would you approach that? Number two, the basic healthcare system is crumbling. If you go to my health center in Malala, the community walk-in, which we call access to the buildings and whatever, but there's no medications. There is understaffing. And the quality care, which we are talking about all the time, access, affordability, and quality of care is not there. How are you going to approach it? Lastly, the issue of vertical programs. Programs which are being run from the Ministry of Health, and yet health is devolved. I'm talking about the mosquito nets, the TB, the malaria program. What is your view? Why can't this be devolved to the counties? And if donors are involved, what would you do to ensure that they're implemented and oversight is done at the county level? Thank you, Chair.
Thank you. Honorable Oron.
Thank you, Chair. Chapter 6 of the Constitution and the Leadership and Integrity Act of 2021 bestows upon state public officers the highest level of trust and integrity. The MOH has been referred to as a mafia house as a result of perceived lack of accountability. In your opinion, is this justifiable, perceived? What do you think needs to happen to change such a perception?
Thank you. Dr. Amoth.
Thank you, Honorable Chair, Honorable members. The question from the co-chair about the guidelines not being signed, as the petitioner presented, they led a delegation to the Cabinet Secretary, who instructed that we put that process on hold until we listen to this group of people. I know we have scheduled meetings with the Catholic community regarding these documents, but they have not been forthcoming for us to be able to engage. We are going to pursue this further so that we can be able to bring this matter to a close, because as I stated earlier, the guidelines are supposed to actualize Article 26(4), and it is meant for healthcare professionals. Professor Jaldesa talked about equity. Equity is very important for us in terms of healthcare delivery. One of the challenges that has bedeviled the health sector is inequity, especially in deliverance of quality curative services. Our approach this time is different. We want to focus more on primary healthcare systems, which tend to be more comprehensive, inclusive, equitable, and promote solidarity. That if we invest in the primary healthcare system, then we can be able to address most of those inequities, because investment of 1 shilling in the primary healthcare system gives you a dividend of up to 13 to 16 shillings. That is why we are focused on the community health promoters. And so far, Honorable Chair, that approach is yielding very, very interesting results. For example, nearly 88,000 of the community health promoters have the gadgets into which is embedded electronic community health information system. Since their launch last year, they have registered 7.2 million households into the electronic platform. They have assessed 4.6 million children under 5 for various diseases. They have screened 4 million Kenyans for diabetes and 3.3 million Kenyans for hypertension. If we were to strictly go the curative way, I don't see how we could have achieved such milestones in such a short period of time. We have gone ahead further to propose, and you passed, and we thank you, the Facility Improvement Financing Act that is supposed to ring-fence health resources at the health facility level. We believe with all the public health facilities getting reimbursements from the primary healthcare fund, from the social health authority, which is contributory, and also from the emergency chronic and critical illness fund, then we will be able to have a resource envelope that we can be able to use to improve our facilities to make them at par with the rest of the country. On top of that, the professor talked about my vast experience in the global health diplomacy. There are certain people you can be able to meet, and through mutual agreement, bits of support can be able to come into the country.
Well, Dr. Patrick Amoth there appearing before a joint parliamentary committee where he's been vetted for the position of Director General after he was nominated by President William Ruto. Remember, he has been in that acting capacity for the last 4 years. We are on that bit. Please stay with KTN for more. And that is where we wrap up KTN News Desk this Thursday.